Okay, good. So remember, the urinary system is also referred to as the renal system. Okay, and at least know the basic function of the urinary system: to filter blood. Okay, again, to remove waste products from the body. Okay, and to maintain fluid and electrolyte balance. I also mentioned that the urinary system also plays a role in controlling your blood pressure. The urinary system also has a way, it contributes to how red blood cells are being produced in your body. How is it able to do that? You know, the kidneys produces erythropoietin. Okay, and erythropoietin is a hormone that stimulates your bone marrow. In situations where your oxygen levels are very low, they stimulate your bone marrow to produce more of red blood cells. And that tells you if a patient is having a renal problem or a problem affecting the urinary system, that patient can manifest signs coming from anemia. Is that okay? Your urinary system plays a role in vitamin D synthesis. Is that okay? And that from that angle, you should know that if a patient is having renal problems or urinary system problems, that patient is likely to experience problems with vitamin D. Okay, and again, vitamin D also plays a role in how calcium is absorbed in your gut. So if a patient is having a problem with vitamin D, that patient will have a problem with calcium absorption as well. And so calcium levels will be very low. Is that okay? So and this tells you the kidney or the urinary system is very important. Okay. Now, basically, when we look at the urinary system, what are the organs there? We have the kidneys, 2 kidneys. Okay. 2 ureters. These are the kidneys. So we have the 2 kidneys. Okay, so we have the 2 kidneys, the right kidney and the left kidney. We have the 2 ureters. We have the right ureter, the left ureter, and we have the urinary bladder. Is that okay? Great. Now, so we have the kidney. The kidney primarily is the organ that does the filtration of the blood, produces the urine, regulates your blood pressure, and maintain the fluid and electrolyte balance. Then we have the ureters. Okay, the ureters basically are responsible for transporting urine from each kidney to the urinary bladder. Then we have the urinary bladder itself. This is a muscular sac that stores the urine until it is ready to be expelled. Okay, then we also spoke about the urethra. And the urethra is more like a narrow tube that carries the urine from the bladder to the outside of your body during urination. Is that okay? Then we started discussing the kidney. Okay. What is the length of the kidney? Yes, what is the length of the kidney? Who remembers? What is the length of the kidney?
10 to 12 centimeters.
Yes, 10 to 12 centimeters. Yes, excellent. 10 to 12 centimeters. If you are asked to describe the anatomy of an organ, I gave you, certain points that you should talk about or you should consider. Do you remember what I mentioned?
Yes.
Who remembers what I mentioned? If you are asked to describe the anatomy of an organ, yes, how do you do that?
So you describe the shape, the size.
Describe the shape, okay.
The size.
Mm-hmm.
The color, if possible.
The color, if it is available.
And
the thickness.
The thickness.
The length.
The length.
And the location.
Yes.
And then the location, okay.
And its relations, whether either the anterior or the posterior.
Okay, the relations of the organ. Any other? Any other?
And also maybe the membranes that form it.
Okay, that is fine. All right, but I'm surprised you've missed most of the key things that I mentioned. If you are asked to describe the anatomy of an organ, at least you talk about the shape. You mentioned that. You talk about the size. Under the size, that is where you point out the length, the thickness, the width, okay, and then sometimes the weight. Okay, so you talk about the shape, you talk about the size. Under the size, that is where you give us all the dimensions, the thickness, the width, the length. Then you talk about the weight. Then you can talk about the color if it is available for the organ you are describing. Then you come to the location. Okay. Then you come to the organ relation. So organs that are related to the organ you are describing. The anterior relation, the posterior relation, the lateral relations. Is that okay? Then you come and talk about the macroscopic anatomy of that organ. If you have the organ and you are looking at it, what can you see? You talk about it. Then you end by now talking about the microscopic anatomy of that organ. If you are given a microscope to visualize the organ, what are you going to see? Once you do all these things, you are done with anatomy of the organ. This is how we do anatomy. Okay, so first of all, you tell us the shape of the organ, the size of the organ, the weight of the organ, okay, the location of the organ, and at the size of the organ, that is where you touch on the length, you touch on the width, you touch on the thickness. Okay, then you talk about the weight of that organ you are describing, then the location of the organ, then the relations of the organ. Okay, so the relation, you look at the anterior, the posterior, the lateral. Okay, then you now talk about the macroscopic. What is the meaning of macroscopic? When we say macroscopic anatomy, what does it mean? Macroscopic, what does it mean?
Things you can see with unaided eyes.
Good. Things that you are able to see, or the parts of the organ that you can see with an unaided eye. Is that okay? And when we say microscopic anatomy, the parts of the organ that you would see with an aided eye. Okay, and that is when we say aided eye, we mean you can see when you are visualizing it through or with the help of a microscope. Is that okay? So once you do all these things, you've done the anatomical description of that organ. Is that okay? Great. So for the kidney, we mentioned that the shape of the kidney is a bean shaped. We've done all these things. I'm just doing a recap. The size of the kidney with the length is 10 to 12 centimeters. With the width is 5 to 7 centimeters. The thickness is 2.5. The weight is 120 to 150 grams. And I described the location of the kidney that commonly in anatomy, when we ask you the location of the kidney, we say it's retroperitoneal. What does that mean? It's located behind the peritoneum. Is that okay? It's located behind the peritoneum. Okay. And I mentioned that one kidney lies on each side of the spine behind the peritoneum. Now, there is another key thing with respect to the location of the kidney. The right kidney is positioned slightly lower than the left, okay, due to the presence of the liver. Okay, let's come here. Look at this. You can see clearly that you see the right kidney is slightly lower than the left. This is the right kidney. And this is the left kidney. Clearly from this diagram, you can see the right kidney is slightly lower than the left, meaning the left is a bit upper compared to the right one. Okay, and the reason is because of the location of the liver. Is that okay? And that is something very key in anatomy. The right kidney is positioned slightly lower than the left kidney due to the presence of the liver. Okay, and that is a very key anatomical feature that you have to know. They can ask you in exams, why is it that the right kidney is slightly lower than the left kidney? What will be your answer? Yes, what will be your answer? What will be your answer? Why is it that the right kidney is slightly lower than the left? What will be your answer?
The presence of the liver.
Yes, because you see, the liver sits on top of the right. The liver sits over here. Okay, and it falls a little on the right kidney. So, and because of that, it makes the right kidney to come down a little. So in anatomy, we say, as part of the description of the location of the kidney, we say the right kidney is slightly lower than the left. When we ask you this in exams, why is it that the right kidney is slightly lower than the left? The reason is because of the presence of the liver. Simple as that. If we ask you in exams, why is it that the right kidney is slightly lower than the left? It's because of the presence of the liver. Okay, good. And that is a very important anatomical description in addition to the other descriptions regarding the kidneys. Okay, and again, you also mentioned that in relation to the spine, the kidney is located between the 12 thoracic vertebrae and then the third lumbar vertebrae in relation to the spine. So in relation to the spine, the kidney is located between the 12 thoracic vertebrae and the third lumbar vertebrae. Okay, so we can ask you that, okay, in relation to the spine, what is the location of the kidney? It is located between the 12 thoracic vertebrae and the third lumbar vertebrae. Okay, so all of this fits a description. So you see, in exams, I can ask you that, okay, which of the following is a correct description? Listen to this very carefully. Which of the following is a correct description of the location of the kidney? Listen carefully. I. The kidney is a retroperitoneal organ. I. The kidney is located between the 11th thoracic vertebrae and the third lumbar vertebrae. I. The right kidney is positioned slightly above the left. Let me take the question again. I'm not done. Oh, relax. Now, the question says that which of the following is a correct description of the location of the kidney? I. The kidney is a retroperitoneal organ. I. The kidney is located between the 11th thoracic vertebrae and the third lumbar vertebrae. I. The right is positioned slightly above the left. Then I'll go A. I only. B. I and I only. C. I and I only. What will be your answer?
A.
Yes, the answer is A. I only. Okay, the answer will be A. I only. Okay, good. But in this situation, it's the I only that is correct. But I can give you a question of the same style that two of them may be correct, and you would, if that is the case, you find the two reflecting in the options for you to circle. Is that okay? Yes. So the location of the kidney is also a good area that you should expect questions on all the time, especially when we are dealing with the urinary system. Okay, good. So, with description of the location, the kidney is located behind the peritoneum. One kidney lies on each side of the spine. It's located between the 12 thoracic vertebrae and the third lumbar vertebrae. The right kidney is positioned slightly lower than the left due to the presence of the liver. Then we spoke about the anterior relations and the posterior relations. I gave you a trick regarding the posterior, that posterior to the kidney, the structures we have there are muscles and then nerves and blood vessels. So that is a trick that you can use. But we also discussed further details regarding the anterior relations. The anterior relations to the right kidney is different. The anterior relation to the left kidney is also different. And that is also an examinable area. We've discussed that intensively in class. Then we came to the part of the kidney. And I told you this diagram or this slide is actually showing the macroscopic anatomy of the kidney. So I'm expecting that by now, if you've printed out your slide, you've written it on top. This very slide is showing the macroscopic anatomy of the kidney and their functions. Is that okay? Great. So that if we ask you to list the structures in the macroscopic anatomy of the kidney, I can ask you to do that in exams, that you should list the structures on the macroscopic anatomy of the kidney. So the structures, we have the renal capsule, the renal cortex, the renal medulla, the renal pyramids, the renal papilla, the calyxes where we have the minor calyx and the major calyxes. We have the renal pelvis and the renal ileum. So these are the structures that we have Okay, in terms of the macroscopic anatomy of the kidney. Okay, which part is the renal capsule? Yes, which part is the renal capsule? Which part is the renal capsule? Yes, which part is the renal capsule?
The outer
Is
layer.
the 12 fibers outer covering of
The
the
Yeah, so
kidney?
outer
which
layer
part
of
is
the
the
kidney.
outer? Which part is the outer layers?
The renal capsule.
The renal capsule. No, I'm asking that which part is the out? If you say outer layer, there are two outer layers, so you have to be very specific. Yes, because the cortex is also part of the outer layers. You get it? So be very, very specific when you are speaking anatomy. So how best can you put that statement?
This is the outermost
The
layer.
outermost.
Good. Yes. Yes. I think I prefer that. That is the outermost region of the kidney or the outermost covering of the kidney. Okay. In terms of its anatomical description, it's a tough fibrous outer covering of the kidney. Okay. So when we say renal capsule, that is a tough fibrous outer covering of the kidney. That's the renal capsule. Okay. Good. And when we say the renal cortex, that is the outer region of the kidney next to. Is that okay? So the renal cortex is the outer region of the kidney next to the renal capsule. Okay, that is the renal cortex. Then we have the renal medulla. Okay, good. The renal medulla. Which part is the renal medulla? When we say renal medulla, how did we explain it in class? Yes, which part is the renal medulla?
The
A
inner
space
part of the kidney.
Good. The room inside the kidney or the inner part of the inner region of the kidney. That is the renal medulla. Okay, so when we say renal medulla, we are looking at the inner regions of the kidney. Is that okay? Great. And what's the difference between the renal medulla and then the renal columns? What is the difference? What's the difference between the renal medulla and then the renal columns?
So please, the renal column is the space between the pyramids, and
Good.
then the renal medulla is the inner part of the kidney.
Good. So you can say the renal column is also an aspect of the renal medulla, or it's also a space just like the renal medulla, but specifically space in between the renal pyramids. You should be technical with another. Please, if you discuss, you go and sit somewhere, exams will be a tough situation for you. Because you see, in anatomy to express, we expect you giving us exactly how the thing is. It's very technical. So, and that is why you should be reading it all the time. Okay, so that you become familiar with those technical concepts. Okay, yeah. So when we say renal column is also an aspect of the renal medulla, but specifically the spaces in between the pyramids. Okay, so the spaces in between the two renal pyramids, that is where we have the columns. Is that okay? So you see, we have one column here. We have one renal column will be here. 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 Okay, so 1, 2, 3, 4, 5. So how many pyramids do we have? 1, 2, 3, 4, 5, 6. So if a kidney is having 7 renal pyramids, how many columns will be there?
6.
Renal pyramids. How many renal columns will be there? Yes.
6.
Good. 6 renal columns. Okay. If I can also tell you a kidney is having 7 renal columns. How many pyramids are there?
6 pyramids.
Hey, did you listen to the question?
8 pyramids.
All right, that is fine. Okay, so I mentioned 7 renal column. So the answer should be the other way around. Should be 8. So the latter answer was correct. Okay, that is fine. So yes, and that is something that you should know. So, and these are the pyramids. So this is what we call the renal pyramid. So we have renal pyramid. So we have 1, 2, 3, 4, 5, 6. These are all renal pyramids. That doesn't mean all kidneys have 6 renal pyramids. So this is a diagram. 1, 2, 3, 4, 5, 6. That does not mean all kidneys have 6 renal pyramids. Is that okay? Good. So these are the renal pyramids. Now, at the apex of each of the pyramids, how do we have the apex here? Here, the apex. Here, what is the name given to the apex of the renal pyramids?
Renal papilla.
Good. Yeah, renal papilla. Renal papilla. So we have renal So if a kidney is having 7 renal pyramids, how many papillas will be there?
7.
7.
Okay, excellent. Yes, excellent. Okay, excellent. So if a kidney is having 7 renal pyramids, we are expecting 7 papillas to be there. Okay, because each pyramid is having a papilla. Each renal pyramid will have a renal papilla. Okay, great. That is fine. Okay, now from the renal papilla, we have the minor calyx. So over here, we have the minor calyx. So each of the kidneys too would have its corresponding minor calyx. So you see, here we have a minor calyx here. We have another minor calyx here. We have another minor calyx here. We have another minor calyx here. Minor calyx here. Okay, so we have minor calyx, minor calyx, minor calyx, minor calyx, minor calyx, minor calyx. Okay, let me ask you this question. A kidney is having, there are 6 renal columns in a kidney. How many minor calyxes should be there?
7.
Hey, someone said, what did you say? You are laughing yourself. Interesting. Okay, so a kidney is having what did I say? 5? Did I say 6 or 5?
6.
Good. 6 renal columns. How many minor calyxes will be there? What will be the answer? 7.
5.
Why 7? Because why 7?
Because the pyramids are 7.
Yes, because the pyramids will be 7. Is that okay? So once it is having 7 pyramids, it will have 7 minor calyxes. You see the way we are describing, that is exactly how exams will appear. If you ask students I've taught, I will never ask you any question in exams I've never mentioned in class. Every single thing I will examine you on, at a point in time, I mentioned it exactly how it is in the classroom or in an online meeting. Just the way we are describing it in this meeting. So please pay attention to things. Okay. All right, that is fine. So now we move on to the major calyx. So you see, the minor calyxes are now joined together. So you see over here, if I point any space here, it's a minor calyx. So here, we have a major calyx over here. You can also call this space a major calyx. You can also come and call this space a major calyx. I'm not so happy where they've pointed the renal pelvis here. Renal pelvis should be located somewhere here. So let me show you this diagram. So you can consider this space. So you see where this space, you see this space here. Here, you can consider this space better as the renal pelvis. Okay, so you see this picture is even labeling it here. There's the renal pelvis. So I prefer this one rather. But a space here, even here can be considered. The spaces here can be considered as renal pelvis. But here, this is more of pointing to the major calyx. This one is more of pointing to the major calyx. But it's good that you appreciate what we mean by renal. So from the major calyx, you are going to the renal pelvis. Is that okay? So if this arrow was to come here a little, I will be very happy here. If it was to point here where the cursor is now, fine. That is perfect position for the renal pelvis. Is that okay? Great. But here is a major. If I point anywhere here where the cursor is now, it's a major calyx. If I point here, where I'm pointing now, it's a major calyx. and then where they've actually labeled major calyx to fit for a major calyx. Is that okay? Great. So from the major calyx, we come to the renal pelvis. From the renal pelvis, we come to the ureter. Okay, ureter. Okay, so here is the ureter. Is that okay? Okay, what is the name given to the area of the kidney where the renal vein, renal nerve, and renal arteries enters the kidney? What is the name given to that area?
Renal
Renal
helium.
helium.
Renal helium. So in exams, if I do something like this, if I try to use some shapes to point from here and bring it down and come and point from here, you should know that is a renal helium. Now remember, you should be competent as drawing this diagram. You should be able to draw it and label the part completely. Again, you should also be able to label the part when you are in the diagram. So one, you should learn how to draw it when you are giving, you should learn how to draw it when you are asked to. You should learn how to label the part when you are giving the diagram to. Is that? And you also should be able to describe the parts, the features. So if I ask you that, I can ask you to draw a well-labeled diagram of the macroscopic anatomy of the kidney and describe any 4 of the parts labeled. So I can ask you, okay, draw with a well-labeled diagram, draw the macroscopic anatomy of the kidney, okay, and describe any 4 of the labeled parts. Very simple question. Is that okay? So when we say renal helium, the space, the area or the region where blood vessels, the blood vessels, the renal veins, renal artery, renal nerves enters the kidney. That is a renal helium. Okay. When we say renal pelvis is a funnel shape that connects the major calyxes to the ureters. Okay, renal pelvis, that is the funnel shape structure that is connecting the renal, the major calyxes to the ureters. Okay, then we have the minor and major calyxes. The minor and major calyxes connects the pyramids to the renal pelvis. Then we have the renal pyramids. That's the cone-shaped structures. So you see, these are the pyramids, the ones that are looking like cones. The cone-shaped structures within the medulla. Simple as that. The cone-shaped structures within the medulla. That is the renal pyramids. Okay. Then the renal medulla is the inner region or the room within the kidneys. So within the medulla, that is where we have the pyramids. Okay, then the renal cortex is the outer layer or region of the kidney next to the renal capsule. Then the renal capsule is the outermost fibrous covering of the kidney. Okay, that protects the kidney. Okay, great. And this is what we also call internal anatomy of the kidney. So remember in exams, if I ask you draw the internal anatomy of the kidney, it's the same diagram. Draw the macroscopic anatomy of the kidney, the same diagram. Okay, great. Then we came down to the macroscopic anatomy of the kidney. When we say macroscopic anatomy of the kidney, what does it mean? Yes, when we say macroscopic anatomy of the kidney, what does it mean? Sorry, the microscopic anatomy of the kidney, what does it mean? Microscopic anatomy of the kidney, what does it mean?
The
The
nephron.
nephron or the internal part of the kidney.
Oh, it's not true. Yeah. If you say
The
internal
nephron.
anatomy of the kidney, this is the diagram. Yes, that is the nephron. Don't add anything to it.
Okay.
Yeah, so when we say microscopic anatomy of the kidney, that is the nephron. Okay, microscopic anatomy of the kidney. Basically, that is the nephron. Is that okay? Yes. And this is how that diagram looks like. So there's a diagram of the microscopic anatomy of the. So in exams, we ask you to draw the microscopic anatomy of the kidney. You come and draw this. It's wrong. Pay attention. In exams, we ask you to draw the macroscopic anatomy of the kidney. You come and draw this one too. It's wrong. So you should know the difference. Okay, so if we ask you draw the microscopic anatomy of the kidney, this is the microscopic. We want you to draw the nephron, this one. This is what we call the anatomy of the nephron. Is that okay? So the lady that wanted to say eternal, no, that is not eternal anatomy of the This one, we call it the anatomy of the nephron. Okay, yes, and that is the microscopic anatomy of the nephron, or anatomy of the nephron. Okay, good. So this is it. So if we ask you to also draw and label the anatomy of the nephron, this is what you are. Okay, what are the parts of the nephrons? Yes, what are the parts of the nephrons?
The Bowman capsule.
Okay, the Bowman's capsule is one of them. Any other part? Let me.
Glomerular.
The glomerulus. Any other?
Glomerular.
Distal convoluted tubule.
The distal convoluted tubule is also one of the parts. Any other?
The collecting duct.
The collecting duct is also one of the parts. Any other?
The loop of Henle.
The loop of Henle is also one of the parts. Excellent. Any other thing? The proximal convoluted tubule is also one of the parts. Okay, but please, in anatomy, learn it properly. Don't say loop of Henle and leave it there. Loop of Henle, which is divided into ascending limb and descending limb. You see, one thing is that if you don't want to be detailed, you don't come closer to anatomy, because anatomy will always expect you to be detailed. Because if you are describing something, anatomy is like giving direction. No? Anatomy, the study of anatomy is like giving direction. It's like you are going to Pentecost University. You can't describe and end at Kwashima and leave the person there. The person will get to Kwashima and will not get to Pentecost. That's how anatomy is. It's a description. So when you are describing, you have to be detailed and specific. Is that okay? All right, that is fine. So these are the basic parts of the nephron. So basically, these are the parts of the nephron. So we have the Bowman's capsule, okay, which we also call the glomerular capsule. You remember I mentioned that in class. The Bowman's capsule is also called the glomerular capsule. Then we have the glomerulus, okay. We have the proximal convoluted tubule. We have the loop of Henle, the distal convoluted tubule, the DCT, and we have the collecting duct. Okay, so, but then if you want to add the afferent arteriole and efferent arteriole to it, that is fine. So if we ask you, what are the parts of the nephron? Even if you don't know anything, at least you should know the parts. Oh, the nephron has about 8 parts. Okay, so what are the parts? We have the glomerulus, we have the glomerular capsule or the Bowman's capsule, we have the proximal convoluted tubule, we have the loop of Henle, which is divided into the descending limb and the ascending limb. We have the distal convoluted tubule or the DCT, and we have the collecting ducts. Okay, then we have the efferent arteriole and efferent arteriole. Let me go over again. What are the parts of the nephron? We have the glomerulus, we have the Bowman's capsule, which we also call the glomerular capsule. We have the proximal convoluted tubule, the PCT. We have the loop of Henle divided into the descending limb and the ascending limb. Then we have the distal convoluted tubule. Then the last part is the collecting duct. But again, you can also add the afferent arterioles and then the efferent arterioles. Now, my question, what are the parts of the nephron?
Glomerulus.
Okay.
Bowman's capsule.
Bowman capsule.
Bowman's capsule or glomerular capsule, yes.
The proximal
convoluted tubule.
The proximal convoluted tubules.
The loop of Henle, which is divided
The
Ascending and ascending.
The distal convoluted tubule and
the collecting duct.
the collecting duct. Okay, something is still missing.
Afferent
arteriole and the efferent arteriole. So in exams, I can just ask you to state the anatomical parts of the nephron. That's all. I can ask you to state the anatomical parts of the nephron. I won't tell you state 5. I will just tell you state the anatomical parts of the nephron. So the anatomical parts of the nephron, the afferent arteriole, the efferent arteriole, the Bowman's capsule, the glomerulus, the proximal convoluted tubule, the PCT, the loop of Henle divided into the descending limb and ascending limb, the distal convoluted tubule, the collecting that you are done. These are the anatomical parts of the nephrons. Okay, so if I ask you, state the anatomy of the nephron, this is what I mean. The Bowman's capsule or the glomerular capsule. Okay, if we put the Bowman's capsule and the glomerular capsule together, what is the anatomical name for that?
Renal corpuscle.
Good.
Renal corpuscle.
Renal corpuscles. So when you put the glomerular capsule plus the glomerulus together, this. So it means here, this one, here, what you are seeing, this one. We call it this one. What you are seeing over here.
We cannot all see it.
Oh yes, sometimes that is the network. Yes, so but some of you, can you see?
Yes, sir.
Good. So once even if one person can see, it's not from my end. So check the position of your device and then adjust your location and let's see if it helps. Yes, so we have the glomerulus plus the glomerular capsule. If you put the renal corpuscle, okay, so if you put these two together, that's the renal corpuscles. Is that okay? Okay, so if you ask you what is renal corpuscle, that's the glomerulus plus the Bowman's capsule put together. Okay, what is another name for the glomerulus?
Trilayered filtration.
Oh, it's not trilayered filtration. It's not true. Yeah, it's not trilayered filtration. Come again.
Bowman capsule.
Oh, it's not Bowman's capsule. Never at all.
The network of capillaries.
No.
So, network of blood vessels.
That is not what we described in class. What is another name for glomerulus? Come again.
Glomerular capsule.
Oh, the young lady that said glomerular filtration, you are closer. But hey, glomerular capsule is another name for Bowman's capsule. Please.
Membrane.
Yes, you are now talking. That is what we mentioned. And sometimes it's sad though, that the student will write. So you see this lady that said glomerular filtration. Next time it's wrong. Go. That is not. You have to say glomerular filtration membrane, because if you say glomerular filtration, it's a different thing that you've said. Glomerular filtration is also something different. Glomerular filtration membrane. That is another name for the glomerulus. But we even said trilayered filtration barrier or trilayered filtration membrane. Please, stop sleeping. Oh. Please, people should stop sleeping. Oh. Learn the thing well. We mentioned this thing in class. We repeated it several times. Here is it. We repeated it several times. I even went around to ask you questions severally. Okay, trilayered filtration barrier. Here is it, filtration membrane. So you see the reason why I'm telling you, if you say glomerular filtration, it's incorrect. The word is not glomerular filtration. It's glomerular filtration membrane or glomerular capillary membrane. That is the name. Or trilayered filtration barrier. Okay, great. So please learn these things well. Please don't be relaxed with anatomy. Okay, glomerular filtration membrane. So when we say glomerulus, so this glomerulus, that is another name for it. This one. Okay, so I told you that it looks like a network of blood vessels, but in actual sense, it's in 3 layers. Okay, what are the 3 layers?
The capillary and the
Yes, what are the 3 layers?
Capillary,
the basement
and the cilium of the capillary.
Okay.
The podocytes.
Okay. Oh, can I have one person to give me an orderly answer?
So please, then the cilium of the capillary.
Okay.
The podocyte.
Okay.
Basement membrane.
And basement membrane.
Let me give you scientific advice. Let me give you scientific advice. in a scientific lecture, when we ask you a question, attempt to answer it in your mind, or attempt to answer by writing down first before you comment. Okay, in future, you go to the ward, let's say you are doing ward rounds, you're in charge, ask a question, attempt to put it down first before you come out. Now, why is that important? That will help you to organize your points. Because the reason is because in science, when you are giving an answer, as much as possible, if the answer is expected to be orderly, we expect you to come that way. In science, we don't expect you to just give information like you are giving social points. No. So you see, the best answer to this question is that, okay, say, the first layer is the endothelium of the capillary. You see, if someone is a strange person in the class, you've confused the person because someone is saying podocyte, someone is saying basement membrane, someone is saying this. We don't do that in a scientific class. So you have to be orderly that, oh, okay. So you see, and if you had put down your points, oh, okay, the question says, what are the layers of the glomerulus? Okay, the layers, even if you didn't know how it is arranged, you put it down first. Then you start, oh, okay, we discussed that this one will come last too. Oh, this is the middle one. Oh, this is, and now you come and answer. Okay, so the first layer, we have the endothelium of the capillaries. Oh, okay, the middle layer is the basement membrane. And then the last layer is the podocytes. Because in exam, if I ask this same question and I'm marking an attention to someone who organized it, even if I don't tell you to organize. So if the score is even 5 marks and you listed it, you didn't organize, you've gotten all the 5 marks. The person who ordered it, it's possible I will give the person an additional consideration. And you may not get the same score like that student. Is that okay? That is what we believe in science.
Right.
You have to be orderly. Okay, so the first layer, endothelium of the capillaries, that's the innermost layer. Okay, the endothelium of the capillary. So here is the endothelium of the capillary. So you can call it the capillary endothelium. Now, the reason why, if you've observed, when I'm teaching you anything and there are other similar words, I repeat it. When you are going to learn, don't decide to go and learn one aspect. Because a question can come in exams. You know the answer to be endothelium of the capillary. But in the MCQ, I will use the capillary endothelium because I expect you to know the two. Yes, we expect you to know the other side. So there are some terms that you realize they have multiple names. A certain question, the answer can be Bowman's capsule. You won't see Bowman's capsule there, you see glomerular capsule. Don't say we didn't. And that is why I keep repeating. Some of the concepts have multiple names. Learn all of them. So when you are learning everything, learn all of them. Okay. For example, you see the podocytes. For the podocyte is epithelial cell. Don't decide to learn the podocyte and throw this one away. Because in an exam question, I can ask a question like, okay, the outermost layer of the glomerular filtration membrane. Is that okay? The outermost layer of the glomerular filtration membrane, closest to the Bowman's capsule, is referred to as. You see here, the answer is the podocyte. But you check, the podocyte will not be there. But maybe B, then I've labeled it epithelial cells. You say, hey, this one, the answer is not there. It's there. Don't learn words that have other names. Learn the two. Don't learn one and drop the other out. And all those words, I would emphasize on it in class for you to know. Okay, so another name for the endothelium of the capillaries is the capillary endothelium. Then we have the basement membrane. The basement membrane is also called the glomerular basement membrane. Then we have the epithelial cells, which we also call the podocyte. Okay, so you should know the layers. We have the middle layer, hot membrane. Okay, which layer is closest to the Bowman's capsule? What would be your answer? Which of the layers of the glomerular filtration membrane is closest to the Bowman's capsule?
The podocyte.
The podocyte food process or the epithelial cells. Excellent. Okay, which of the layers do we have the fenestrations or the pores? Which of the layers of the basement glomerular filtration membrane do we have the fenestrations or the pores? Yes. Yes.
The cilium of the capillaries.
The endothelium of the capillaries, or the capillary endothelium. Is that okay? Great. Great. Which of the layers do we have the filtration slit?
The podocyte.
Good. The podocyte foot process, or the epithelial cells. Is that a description? Then I ask you, which of the layers of the glomerular filtration membrane do we have a feature called the filtration slit? The answer can be the epithelial cells. The answer can be the podocytes. So if you go, the podocytes are not there. Don't go and say the answer is not there. You have to learn all the two names. Is that okay? Great. We can also ask you which of the layers has the slit diaphragm. Okay, and that still remains the epithelial cells. Is that okay?
Yes.
So the podocytes are the foot-like process, okay, also called the pedicels. The podocytes have foot-like process, also called the pedicel, which interlock to form the filtration slits. Okay, good. So that's the filtration slits. Okay, then we have the slit diaphragm over here. So this is a slit diaphragm. This is a slit diaphragm. This is also another slit diaphragm. And you see, the glomerular capillary membrane is the one that is having the fenestration. So this is a fenestra. This is a fenestra. This is a fenestra. This is a fenestra. Is that okay? Great. So how many layers does the glomerular filtration membrane has? How many layers? How many layers?
3 layers.
3 layers. Which one is the middle layer?
The basement membrane.
The basement membrane. That is the middle layer. Okay. Which of the layers is far away from the Bowman's space? Which of the layers is far away from the Bowman space?
And the cilium of the capillaries.
Good. Endothelium of the capillaries, or the capillary endothelium. That layer
Yes.
is far from the Bowman space. Now, remember, as we are going, I'm giving you the area. So this diagram is also an examinable diagram. It's a diagram we can ask you to draw and label. Is that okay? Yes. So pay attention to it. You have to master how to draw and label this diagram. But I think if this diagram comes in exams, it's one of the simplest things. Imagine a diagram having 3. In fact, I may not even consider bringing. Imagine a diagram having just 3 parts for you to draw in anatomy. No. Yes. So you see, we have the capillary endothelium, glomerular basement membrane, and then the podocyte foot process. Just 3 parts. Then at least you have to show the fenestra. You have to show the filtration slit. Oh, who are we getting the feedback from, please? Yeah. All right. You have to show the filtration slit. You have to show the slit diaphragm. Okay, great. And if you draw this diagram to, at least you also have to show the fenestra. Okay, so I think it's a very simple diagram that you can master. If it happens to come in exams, you draw and label it nicely. Okay, then we came down to juxtaglomerular apparatus. Do you remember the juxtaglomerular apparatus? What did we say about the juxtaglomerular apparatus?
So you said it's the junction where the
Yes.
So you said it's the junction where
where the
distal convoluted
apparent
tubule
tissue and then the distal and the meat where they meet.
Okay,
So
that is
you
excellent.
said it's the junction
Go ahead, we are listening.
where the distal convoluted tubule
And then the
touches
afferent
the
arteriole when they meet.
Excellent. Yes, it shows that you people really remember. That is good. I'm very proud of you guys. So the junction where or you can say the
afferent
point
arteriole.
where the distal convoluted tubule contacts the afferent arteriole. Is that okay?
Yes.
So I told you the other time that if the diagram you are using to learn the nephron, if it is a good diagram, it is a good anatomical diagram. When the distal convoluted tubule rises, it has to go and pass and touch the afferent arteriole. Is that okay? So you see this diagram. This is the proximal convoluted tubule. This one is the proximal convoluted tubule. This is the loop of Henle. This is the descending limb of the loop of Henle. This is the ascending limb. And this part is the distal convoluted. You see, from here going is the distal convoluted tube. You see, this is the afferent arteriole. It is touching the distal convoluted tube. So this junction here, this junction is the juxtaglomerular apparatus. This. So when we say juxtaglomerular apparatus, the point where the afferent arteriole touches or contacts the distal convoluted tubule. And I can use that to set a question like, okay, which of the following statements or anatomical description is a correct representation, okay, or correctly explains the juxtaglomerular apparatus? A, the point where the proximal convoluted tubule touches the efferent arteriole. B, the point where the proximal convoluted tubule touches the afferent arteriole. C, the point where the afferent arteriole touches the distal convoluted tubule. What will be your answer?
The C.
What will be your answer? Hey,
C.
someone is saying B. Sure.
Say
Juxtaglomerular
C.
apparatus, and you are thinking about
So the
proximal
C.
convoluted
So
tubule.
say
Never.
C. Say the C.
Never.
The C.
A C. The point where afferent arteriole touches the distal convoluted tubule. In juxtaglomerular apparatus, don't think about proximal convoluted tubule in exams. You get it wrong. Okay, so when we say juxtaglomerular apparatus, the point where the distal convoluted tubule touches the afferent arteriole. Now, what is so special about that junction? Who remembers? What is so special about that junction?
So you said part of the
Put your points on paper, then come back again.
Say please. They both have cells
Mhm.
and glomerular cells. Is the
hello.
afferent arteriole
Okay, that
and
is
the
fine. Oh, relax, Adelaide, relax, eh? Let your sister finish, eh? Michi is on the
and
floor. Let her finish, eh?
the afferent arteriole has the juxtaglomerular cells, which produces the renin,
Okay.
and the afferent arteriole has the macula densa cells,
No,
which
pause there. Don't
produces
continue.
which.
Don't continue. No, don't continue. Else, you destroy anatomy.
Okay, say I've
So
remembered.
you said
Sorry.
the distal
The
cumulative distance. That one produces the muscles or whatever.
Please don't. It's okay. Don't continue. Ube bubu anatomy, no. Don't continue. Organize yourself properly and come back again. Yes, who remembers what we said about what we discussed about this very junction? Yes, who remembers what we discussed regarding this very junction? What is so unique about this junction? Yes. Hello.
is it the renin?
Hey, so none of you remember the specific
We were
things we
trying to
mentioned?
jot it down before.
That is fine. Okay, yes, I like that. Good. I like that.
Please, is it about the juxtaglomerular cells?
No. What did we say about that junction? That very junction. What did we
Say
say?
the
Yes.
distal convoluted tubule within
Uh-huh.
the juxtaglomerular.
Uh-huh. Yeah. Yeah. Yes. Yes. I like how you started. Yes. We'll continue. I like how you started now. All right. That is fine. I like how she started, but I think there is a break in her network. No problem.
Hello, sir. Hello.
Yes, go ahead.
I said we can locate the.
Yes, go ahead. We are listening.
We can locate the. Okay, we can locate the juxtaglomerular cells in the afferent anterior within the juxtaglomerular apparatus.
Good. Excellent. Brilliant description. Yeah. It shows you paid attention in class. We can locate the juxtaglomerular cells within the afferent arteriole in that junction. Excellent answer. The second point.
Okay, and say we said that we can locate the macular denser cells in the distal convoluted tubule within the juxtaglomerular apparatus.
That is 100% correct. Excellent. Yes, that is the best response I'm expecting. Yes, this is an organized anatomical response. Yes, so we can locate the juxtaglomerular cells in the afferent arteriole in that junction. And we can also locate the macular denser cells in the distal convoluted tubule in that same junction. Is that okay? Okay. How many types of nephrons do we have? What did we say? How many types of nephrons do we have?
So we said two.
Two types of nephrons. What are the two types of
Yes,
nephrons?
sir.
Cortical
We have
nephron
the
and the
The
juxta
cortical nephrons. And then,
medullary nephron.
so the cortical
juxta
nephrons,
medullary
the
nephron.
cortical
Medullary
nephrons,
nephron.
the cortical nephrons, and then the juxta what? Medullary nephrons.
Nephron.
Okay, now let's discuss the anatomical difference. What are the characteristics of a cortical nephron? Give me all the anatomical description of the cortical nephrons. If someone asks you what is a cortical nephron, what will you say?
Sir,
Yes, go ahead.
the cortical nephron, their glomerulus are within the cortex.
They are, don't say it that way. Debbie, you see anatomy, anatomy is a professional course. It's like you see when you are going to, sometimes the ladies who understand, you are going to see a dress. You want them to put this somewhere. You say, oh, put bead somewhere. If the person brings it, a bead is not there, you will not be happy. That is how anatomy is. If you say the glomerulus is in the cortex, anatomy will accept it. What did we say? What was the specific thing you said?
They are deeper in the
Within the cortex.
Why did she remove the deep from there? Once you remove it from there in anatomy, we will have issues with you.
Oh, say I'm sorry.
Yeah. So you have to be straight. And that's why anatomy is technical. That's why you should be reading it over and over and over and over till you get the technical words. Okay. The glomerulus is deep inside the cortex. If you say glomerulus is in the cortex and glomerulus is deep in the cortex, it's two different directions. So if I'm going to Sotium, you say, oh, the school is deep in Sotium. The school is in Sotium. It's different locations, different directions you're giving me. The glomerulus is deep inside the cortex. That's the response. What's the second description about this?
They contain about 85% of nephrons in the body.
Oh, organize it well. You have the idea. Put it in a good context. They constitute about 85% of all nephrons. Is that okay? All right. That is fine. That is fine. So that tells you that more of the nephrons we have in the body are what? Cortical nephron. Okay, what is the next feature that we mentioned?
They have short loop of Henle, barely deep in the medulla.
Come again?
They have short loop of Henle, barely deep in the medulla.
Okay, so you can be simple. They have a short loop of Henle. Is that okay? Yes, their loop of Henle is very short. Okay, and just a little portion of their loop of Henle is inside the medulla. So look at it. You see their loop of Henle is very short. And just a little portion of their loop is inside the medulla. From here coming down is the medulla. From here coming down is the medulla. And you can see this is an example of a cortical nephron. You see it's written down here, cortical nephron. And you can see clearly their loop of Henle is very hot, very short. Okay. Any other description?
Sir.
Yes.
Sir, please. I was reading some book and I found the function of the cortical nephron.
Okay, what is the function?
They said it helps in excretion and regulating of electrolytes.
Okay. How about the other nephrons?
The juxta medullary nephron.
Yeah.
The
So they say they are
function.
essential for urine concentration.
They
Come
function
again.
in urine concentrating and
Water
regulating
balance
water balance.
regulation.
Okay, that is fine. That is fine. That is fine. That is a very good research that you've done. Okay, but I think that is also in the slide. So primarily responsible for excretion and regulation of electrolytes is there already. And then we have the juxta medullary nephron, essential for urine concentration and water balance. So that is also part of the anatomical description in terms of its functions. Is that okay? And again, the juxta medullary nephron constitutes 15% of all the nephrons in your body. 15%. Okay, their glomeruli are closer to the medulla. Okay, so look at the juxta glomerular nephrons. You see, their glomerulus are closer to the medulla. So you see their glomerulus, they are closer. Some books will say their glomerulus is at the junction, okay, of the cortex and the medulla. But you can also say their glomerulus is closer to the medulla. You see, this is the medulla. This here. From here coming is the medulla. Coming down is the medulla. And you see the glomerulus is here, so it's closer. But if you look at the cortical nephrons, the glomerulus is deep inside the cortex. Deep. And this one, the glomerulus is closer to the medulla. And we can use all that to do a scenario question and ask you, is that okay? Yeah, so pay attention to the technical description of the features. Okay, and then we went on to look at the peritubular fibroblast-like cells. What did we say about these cells? What did we say about these cells? Yes, go ahead.
They produce erythropoietin.
Good. They produce erythropoietin. Is that okay? The peritubular fibroblast-like cells. Where are they located, please? Where are they located?
The renal cortex.
Good. The renal cortex and the outer medulla region of the kidneys. They produce the erythropoietin. So if we ask you what cells in the kidney produce erythropoietin, peritubular fibroblast-like cells. Okay. Now you can also, what's the other name for these cells? Like cells. Or you can say renal hypoproducing cells. You see, they have several names. So don't learn one name, then you come in exams. You see, I've used the other name to set a question, then you choose wrong answer. So all these are the same cell: peritubular fibroblast-like cells, interstitial fibroblast-like cells, renal hypoproducing cells, the rep cells, the same cell. Is that okay? Great. So remember, okay, and they are located near the proximal convoluted tubules within the renal cortex. Okay, good. Now, hot situation will activate these cells to produce. Hot situation will
when
activate.
there is low blood oxygen.
That is excellent. When there is low blood oxygen, when your blood oxygen levels are very low, these cells will be activated. Okay, and as they are being activated, they begin to, act on the bone marrows to produce more red blood cells. So if we ask you in exams that, okay, the peritubular fibroblast-like cells or the interstitial fibroblast-like cells produces erythropoietin, what situation will trigger these cells to produce, or under what circumstance will these cells will be triggered? Then the answer is straight. Situations where there is hypoxia. So hypoxia can be the answer. Or low levels of oxygen in the blood can also be the answer. When we say hypoxia, it simply means low oxygen levels in the blood. So the answer can be two. I can use hypoxia as the answer. I can also use low oxygen levels as the answer. Low oxygen levels in the blood as the answer. Okay? Great. 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 And then we went on to the ureters. What did we say about the ureters? The ureter is a muscular tube, right? That conveys urine from the kidney to where? The urinary bladder. Is that okay? Great. And we also mentioned that the ureter is approximately 25 centimeters long and then 1.7 centimeters wide, especially when it is getting nearer the bladder. What is the function? It conveys urine or transports urine from the kidney, from here
Out of the
to the
body.
urinary bladder. No, not out of the body. That is the urethra.
Sorry.
This is the ureter. Okay, so the ureter transports urine from the kidney to the urinary bladder. From the kidney to the urinary bladder. So if we ask you, which anatomical organ transports urine from the kidneys to the urinary bladder, what will be your answer?
The ureter.
Good. That's the ureter. Okay, now listen to this one. Listen to this question. Let me show you how we set questions. Listen. Which anatomical structure or organ transports urine from the right kidney to the urinary bladder? Listen carefully. From the right kidney to the urinary bladder. A.
Right ureter.
Oh, listen. Take your time and listen to the answers. A. A.
Is that
A.
right ureter?
Ureters. A. Ureters. B. Right ureter.
Hey, Mecha.
C. All the above. What would be the answer?
Right
Right
ureter.
ureter.
You see, someone will go and choose ureters. Someone will
Hey.
go and choose ureters. Here, the question is specific.
Yes,
The
you
question says
choose.
that the right kidney. Yeah. So the right kidney to the urinary bladder, that is the right ureter. So always you have to be, very also and know what exactly they are asking you. Okay, good. So that is there. And I also, what cardinal feature did we say about this ureter? What is so special about this ureter in terms of how urine flows through it? What is so special about it?
Is that right?
You
Hey,
turn the
Obi,
body upside down, cry. The urine cannot flow back to the.
Excellent. It only permits, it does not permit backward flow of urine into the kidneys. Because you see, the kidneys are such that if urine flows backward, it will cause more functioning in the kidney. And that is what we call renal failure. Okay, when urine leaves the kidney, it's not supposed to return back. When urine leaves the kidney and it returns back, it causes renal failure. So when urine leaves the kidney, it's not supposed to go back into the kidney again. And the ureter allows that. It does not permit or it prevents reflux of urine back into the kidney. Okay, that is one cardinal, relevance of the physiological relevance of the ureters. Okay, then we discuss the layers of the ureter. How many layers does it have? How many layers do we have?
We have 3.
Said 3.
We have what? 3. What are the 3 layers? The mucosa, which is the inner layer. Then we have
The muscularies.
muscularis, which is the
Middle layer.
middle layer. And then lastly, we have
We have the
Adventitia.
the adventitia, which is the outermost layer, or the fibrous outermost layer. Then we came down to the urinary bladder. Then we said the urinary bladder is a muscular, looks like a distensible muscular sac located into the location of the urinary bladder. It's an examinable area. we can ask you a question on the location of the urinary bladder. Okay, and it is posterior to the pubic symphysis and inferior to the peritoneum. You see this? You see this? You see this? You see, I'm pointing at this one. You can underline it in your slide. It's an examinable area. The anatomical location of the urinary bladder. And especially for you, the midwives, this description is very important. Because in reproductive anatomy, this thing will come up again. And if you don't understand this, you don't appreciate why a pregnant woman would now begin to have frequency in urination. The woman will urinate, most of the time. If you don't understand these concepts. Okay, good. So, the urinary bladder is located in the pelvic cavity, posterior to the pubic symphysis and inferior to the peritoneum. Okay, good. It is just behind the pubic bone and in front of the rectum in males and the uterus in females. Okay, so pay attention to the gender disparity here. Okay, pay attention to the gender difference. It is just behind the pubic bone and in front of the rectum in males and the uterus in females. Pay attention very well. That description is also an examinable description specific to the location of the urinary bladder. Okay. It stores urine until it is expelled from the body. What is the capacity of the urinary bladder for the average adult? What is the capacity of the bladder?
500.
Okay. And
Meaning
how much can it expand to contain?
700 to 800.
Good. So it can further expand to contain 700 to 800 mils. If you decide to hold urine for a long time. Okay. Good. What is the name of the muscle that forms the bladder?
Detrusor muscle.
The detrusor muscles. So the bladder wall consists of a muscle we call the detrusor muscle. Is that okay? The detrusor muscles. But then the outermost layer is covered by a fibrous adventitia. And take note of this description too. I can ask you, what is the anatomical term for the outermost covering of the urinary bladder? Fibrous adventitia. Okay, the fibrous adventitia. Okay, and then the bladder wall itself is made up of the detrusor muscle. Okay, the bladder wall itself is made up of the detrusor muscle. Okay, when we say triagon of the bladder, what forms the triagon of the bladder? At that time, I describe it in class. What forms the triagon of the bladder?
Said two
Yes.
ureteric orifices.
The two ureteric orifices.
And the urethral orifice.
Good, excellent. It shows that you paid attention in class. The two ureteric orifices. This one. So we have the right ureteric orifice. This is one. We have the left ureteric orifice. And then the urethral orifice. This one. So these three orifices, 1, 2, 3, they are the ones forming the triagon of the bladder. Okay. So the triagon is defined by the openings of the two ureters. That's the two ureteric orifice and the opening of the ureter. So the two ureteric orifice and the urethral orifice, they form the triagon of the bladder. And it's an area we can examine you on. What forms the triagon of the bladder? Okay, the two ureteric orifice and then the urethral orifice or the urethral opening. Is that okay? What is the name given to this area here? What is the name given to this area where I'm pointing now?
I can see.
Where I'm pointing. Oh, it's not. Don't say we. Say I.
I can
Some
see.
can see.
I can't see.
But someone too is saying.
Some can see.
I
If you can't
can't
see,
see
it's
you.
the network.
I can't see.
I can't
It's
see.
blank.
How many of you can see?
Sammy.
Yeah, so it's the network. So those who can see is the network. Oh. Yeah, so
Everybody can see.
yes.
Hey,
they
we
can
can't
see.
see.
We are
All right.
lacking.
All right. So those who can see, those who can see, what is the name given to this area where I'm pointing?
Sammy, I want to answer. I can't see.
Don't worry. You look at it later. It's unfortunate you can't see, but you look at it later. Yes, I think it's your network that is not helping you. That is fine. So those who
Yes, I
can
think
see,
it's
what is the name given to this area?
The internal uterus sphincter.
Oh, look at the area that I'm pointing on. You see, I'm very specific. I said area. I didn't say structure. So that should have guided you. What's the name given to this area?
The
A bladder
triangular
neck.
muscle.
That's the bladder neck. Yes, we mentioned it in class. You are getting confused because you see, this one is pointing, the label here is pointing a wrong location. The label here, most of the diagrams on the internet is not correct. Look at this, the bladder neck. See, you see here is pointing the right thing here. This is where we call the bladder neck. And if you remember very well, I told you where we have the internal uterus sphincter. It is in the bladder neck. The internal uterus sphincter is inside the bladder neck. So that should have even guided you. Okay, so here we call it the bladder neck. Okay, here. And that is where we have the internal urethral sphincter. Okay, so, and that is what we call the bladder neck or the neck. You see, this diagram is pointing it well. You see the bladder neck. You see, it's pointing the area very well. Okay, so here, down here, we call it the neck of the bladder. Or is that okay? And that is the area we have the internal urethral sphincter. Is that okay? Where do we have the external urethral sphincter? Beneath the prostate gland. You see, this is the prostate gland. Just under it, we have the external urethral sphincter. So how many sphincters are we talking about here in relation to the bladder? How many sphincters? In relation to the bladder, how many sphincters are here?
Please, please.
Yes, two sphincters. So we have the internal urethral sphincter and we have the external urethral sphincter. Is that okay? Great. The internal urethral sphincter and then we have the external urethral sphincter. Okay, great. Now let's use this idea to discuss. If a patient wants to urinate, what should happen? If a patient wants to hold urine, what will happen to the detrusor muscles and what will happen to the sphincters? What did we say? Who remembers? During
Please, you said.
what happens to
So you said when
detrusor
if
muscles and what happens to the sphincters?
so you said when somebody holds their pee, their
The
detrusor
external
muscle
and then
relaxes and the internal and external sphincter contracts.
Good. So as you are holding urine, as you are there, you are not urinating. So if an individual is there and not urinating, the detrusor muscles are relaxed. So once we say detrusor muscles are relaxed, it means you are holding urine. As you are holding urine, the sphincters are also contracting. Is that okay? The sphincters are contracting. So if your sphincters are contracting, you are holding urine. The moment your sphincters relax, what will happen to the detrusor muscles?
they will
They
contract.
It will
contract.
contract. Then urine will now start coming out. So if we ask you, okay, what happens to the detrusor muscles if an individual is urinating? What will happen to the detrusor muscles?
So it will contract.
Relaxes and then the detrusor muscle contracts.
Hey, come again.
So when somebody is urinating, the
Uh-huh.
detrusor muscle contracts and the internal and the external sphincters
Muscles
contract.
relax. What happens to the detrusor muscles? What happens to the detrusor muscles if an individual is holding urine?
So when an individual is holding urine, the detrusor muscle relaxes and the internal and external
Internal and
sphincter
external
contracts.
sphincter contract.
That is excellent. This shows that you've understood. And please remember, as we are discussing, this description is also an examinable area in an MCQ. Okay, so what happens? So you should know if someone is urinating, what will be happening to the detrusor muscles and then the sphincters. Okay, if someone is holding urine, what will happen to the detrusor muscles and then the sphincters? You have to know these things off head. Okay, great. So then that brings us to the end of the urinary bladder. Then we went on to the urethra. Okay, we went on to the urethra. And we mentioned that the urethra conveys urine from where? The urinary bladder to the outside of. Oh, we are having a lot of, feedbacks. Let's get ourselves muted. When it's time for questions, then we can ask our question. All right, good. So we mentioned that the urethra conveys urine from the bladder to the outside of your body. Okay, now, in terms of when you take a female urethra, it's about 3 to 4 centimeters. But when you take a male urethra is about 18 centimeters. Please keep it in your mind, though. So in exams, if we ask you the length of the female urethra, that is a bit shorter. The female urethra is a bit shorter. That is about 3 to 4 centimeters. But male urethra is 18 centimeters. We can ask you that in exams. Okay, so look at it. You see the male urethra is a bit longer. Look at it. Look at this, a male urethra. You see, because the male urethra has divisions. The male urethra has 3 anatomical. Oh, don't worry. It's your network, but I'm sure you'll be fine later on. Okay, you'll be fine. It's the network. Sometimes because of the network, some people may not see. So we have the prostatic urethra, we have the membranous urethra, and we have the spongy or pineal urethra. Okay, so the male urethra is divided into 3 anatomical divisions. We have the prostatic urethra. When we say prostatic urethra, it's the region of the urethra that passes through the prostate gland. You see, this is the prostate. The urethra is from here down here, from here to here. So when we say prostatic urethra, from here to here, the region that passes through the prostate gland, that is what we call prostatic urethra. From here to here, the region that passes through the prostate gland, that is what we call prostatic urethra. Okay, or when we ask you what is prostatic urethra, the region of the urethra that passes through the prostate, prostatic urethra. Okay, then we come down to, we have the membranous urethra. What is membranous urethra? The region of the urethra that passes through the urogenital diaphragm. Oh, we still have some people unmuted. That is causing distraction because some people may have to rely on the recorded lessons. Is that okay? So it's advisable you mute. Okay, so I mentioned that the urethra starts from this point down to this point. From here to this point. From this point to this point. So from here to here, you see from here to here is passing through the prostate. From here to here, this is the prostate gland. So you see this part of the urethra from here to here is passing through the prostate. And because of that, we call that region the prostatic urethra. And that region is 2.5 centimeters long. Now, you see this membrane here, this one is a diaphragm. We call it urogenital diaphragm here. You see this diaphragm here, this one. Okay, urogenital diaphragm. Now, the region of the urethra that passes through this diaphragm here. So you see, that place is very small. Look at the urogenital diaphragm, very small. So you see the length. The membranous urethra, the region of the urethra that passes through the urogenital diaphragm, that is 0.5 centimeters. You see, it's very small, 0.5 centimeters. And this is that region here. This is the diaphragm. So you see, it's very short. It's very short. Okay, the urogenital diaphragm. So when we say, what is membranous urethra? The region of the urethra that passes through the urogenital diaphragm. That region is very short. And then we have the spongy urethra, or you can call it the pineal urethra. The region of the urethra that passes through the corpus spongiosum of the penis. Okay, this is what we call the corpus spongiosum of the penis. Here, you see here, it's start from here. From here, you see, look at where I'm passing the cursor through here. From here. So right from here, it start from here. From here coming down to this point. Let me start again. From here coming down to this point. For the last time, from here, coming down to this point. You see, we've labeled it corpus spongiosum. Now, the region of the urethra that passes through the corpus spongiosum of the penis, that is what we call the penile urethra or the spongy urethra. So when we say spongy urethra, the region of the urethra that passes through the corpus spongiosum of the penis. So now to my questions. What is the length of the female urethra? What is the
2
length
to
of the female
3,
urethra?
2 to 4 centimeters.
3 to
No?
4 centimeters.
3 to 4 centimeters is the correct answer we are expecting. Okay, what is the length of the male urethra?
18
18
centimeters.
18 centimeters.
centimeters.
That is 18 centimeters. How many divisions do we have for a male urethra? How many anatomical divisions do we have for the male urethra?
So you said 3.
3 anatomical divisions. What are the anatomical divisions?
The prostatic
The
urethra.
prostatic urethra, that is 1. 2,
The membranous
Membranous
urethra.
urethra.
the membranous urethra, that is 2. 3,
And then the spongy
the
The
urethra.
spongy
spongy
urethra or the penile urethra. Okay, what is a prostatic urethra?
The first is
The region of the urethra that
the post
passes through the
to the
prostate gland.
Excellent. The region of the urethra that passes through the prostate or the prostate gland. Okay. What is a membranous urethra?
so the region of the urethra that passes through the urogenital diaphragm.
That is excellent. Okay. What is a spongy urethra or a penile urethra? What is a spongy urethra or penile urethra?
The region of the urethra that passes through the corpus spongiosum of the
The
penis.
region of the urethra that passes through the corpus spongiosum. So I can ask you in exams that, okay, the urethra has 3 anatomical divisions. Which division of the urethra passes through the urogenital diaphragm? A. Membranous urethra. Listen to the options. So, membranous urethra. B. Membranous prostatic urethra. What would be the answer?
Membranous prostatic urethra.
Come again.
Say you come.
So I
Membranous
mentioned
prostatic
membranous
urethra.
urethra. A. B. Membranous urethra. And
The
C.
B.
It's
Yes,
B.
membranous
It's B.
urethra. In exams, shine your eyes.
B.
So you've heard of membranous urethra. There is nothing like membranous urethra.
Urethra, yeah.
Okay, so you open your eyes very well. And that is how options will be presented to you in exams.
Okay,
Okay,
sir.
so membranous urethra. Okay, now I can also ask a question that, okay, which of the anatomical divisions of the male urethra is the smallest in terms of its length?
Then the membranous urethra.
Excellent.
Membranous urethra.
Excellent. Another example that I can say, the anatomical divisions of the male urethra has a length of approximately 15 centimeters. What would be the answer you'll be looking for?
The penile or the spongy
The
urethra.
penile or the spongy urethra. You see how we set questions? This is how my questions, I set it. Yes. Good. So you need to understand the anatomical description properly. Good. All right. That is fine. Good. So basically, that is it for the urethra. Okay. Then I can also ask a question in session B that I can ask you a question. Okay. In session B, why is the male urethra longer than the female urethra? Why? Why is the male urethra longer than the female?
Because the male urethra has divisions.
Oh, that is excellent. Yes, it's a very good start. Because the male urethra has divisions. That is great. What will you say about the female? The female urethra also has divisions. So, but see, the female urethra only have one division. That's the membranous. Look at the female urethra. It's only having the membranous. You see, there's the urogenital diaphragm. So the female urethra is short because you see, there's only the membranous. Okay, but the male urethra, it passes through the prostate, it passes through the membranous, and it also has the spongy. That is why the male urethra is very long. That okay? Yes. So a female urethra is very short, and that should tell you that you're a nurse. You are going to pass urinary catheter for a female patient. You have to be very careful. Don't go and push all the catheter inside the person. Is that okay? Yes. If you have a good understanding of this, it will let you understand why you should exercise patience when you are going to pass catheter for a female patient. Okay, yes, that will guide you in how to handle, catheterization in patients. Okay, great. So look at the differences. So the male urethra and then the female urethra. The male urethra is about 18 centimeters. Some literatures will say 18 to 20 centimeters. The female urethra is about 3 to 4 centimeters. Is that okay? Now, the male urethra has dual functional. The male urethra it's a passage for urine and then semen. Keep it in your mind. That is also a difference. Okay, so the male urethra is a passage for urine and a passage for semen. But the female urethra is just a passage for excretion of urine only. Okay, that is also something you have to appreciate. Okay, now again, the male urethra it passes through the prostate, the urogenital diaphragm, and the penis. The female urethra is very short, straight parts above the vaginal orifice. It only has the membranous, the urogenital. It only has the membranous urethra. Okay, then we have the segments, the prostatic urethra, the membranous urethra, and then the spongy urethra. The female urethra is not having any distinct segment. We don't have anything like membranous urethra, prostatic urethra, and then spongy. No. Is that okay? The male urethra is also associated with prostate gland and then erectile tissues. The female urethra is only associated with the urogenital diaphragm. That's all. Is that okay? And that should tell you that females, and that explains the reason why females are at high risk of infections. So in medicine too, if they ask you why are females at higher risk of urinary tract infection, is because they have shorter urethra. Females have very short urethra, and because of that, they are at high risk of infections as compared to males. So if they ask you in exams, why are females at high risk of UTIs compared to males, is because one of the reasons is because females have short urethra as compared. So if infections are rising to the urinary tract, it will be very fast in a female compared to a male. It's fine. And again, because males are also having long urethra, their urethra is also prone to urethral strictures. When we say urethral strictures, narrowing, they are more likely to experience problem relating to narrowing of the urethra or urethral strictures. Okay, so basically that is it about the urinary system. So we have some lessons over here regarding your understanding of the urinary system. So a good understanding of the urinary system is very essential to you as a nurse or a midwife. It's going to guide you in safe catheterization techniques. Because if you know, especially now that you know that, okay, the male urethra is different from the female urethra, it will guide you with catheterization. Okay, and again, during catheterization, we have different types of catheter and we have components of the catheter. We have a part of the catheter we use to inflate. When you inflate of the catheter, where does it lodge? It's going to choke where the bladder neck is so that you can't easily pull it out. Is that okay? Great. So these are all things that you have to know. Okay. Now, understanding of urinary system would also help you with accurate diagnosis and treatment of urinary system conditions. Okay, conditions like nephrotic syndrome, conditions like glomerulonephritis, conditions like acute renal failure, conditions like chronic renal failure, pyelonephritis, cystitis, pyelitis, urethritis, urethritis, and all of that. All these conditions, once you have good knowledge of the urinary system, you understand all these conditions. Your urinary system would also help you to appreciate why, if patient is having urinary problems, they will have problems like anemia, they will have fluid and electrolyte imbalance problems. It will help you to appreciate. Is that okay? Great. So basically, that is it about them. You see, when we pass a catheter for a patient, you see the catheter, we have this one we call the two-way catheter. This part is used to inflate water or injection water. So when you inflate the injection water, you see it's going to choke over here. So when the catheter goes into the bladder, you see where the inflated ball is. So it's going to choke at the edge of where we have the bladder neck. So that if you want to make any attempt to pull it out, there is going to be resistance because of the inflated. So this will let you appreciate that, oh, okay, if you're a nurse and we've done this catheter for a patient, you go and pull it out, patient can be injured. Where would the injury most likely to occur? The bladder neck. Because if you try to pull this out, you will injure the bladder neck. Is that okay? And that would let you know that, oh, okay, then before you pull the fine. So I think we can end over here for today. Okay. Practically we are done